chairs, we can give you an additional response on the current measures that the ministry is undertaking. But also better than that, we'll tell you what we are doing as the county government of Nairobi. Chair, the reduction of mortality, which was very high, I'm sure you remember, even when you were governor, the number of issues on Pumwani, on Mamadusi, DC, that would come up every week were very high. Chair, we changed first the governance structure of our hospitals to make sure that each hospital is led by a CEO at the level 5, not a medical superintendent. A medical superintendent is good, but their training is on offering medical services. The introduction of CEOs, and you can be a doctor and be a CEO, but you must have additional training on hospital management, on supply chain management, on dealing with human resource for health, on dealing with commodities, and and facilities, how the place is it receptive, what is the best layout. There are many things if you look at hospital management science. And that has given us great success in our hospitals. The first thing I did, I can remove this because I'm not reading. Actually, it was the 20th day after being sworn in, also set up as a health reforms task force that was led by Dr. Olive Mugenda and several professionals of note in HR, Dr. Skomi Komunto, in the private sector, Anastasia Nyalita, who is now a CEC, but she was a CEO of private facilities. So there was the owner of St. Mary's, Dr. Frida, to actually come and critically look at the state of health in the city and the facilities and what needs to be done. The implementation of that is what has given us great results. While we regret the death of Wangari, which is regrettable, it is a huge, there's been a big, the numbers used to be very bad. And Chair, one of the things it said that actually embarrassed me, because I was the senator previously, Nairobi County had 0 ICU. 0. Before I got into office. There was no ICU facility in Nairobi County, owned by the county government. The only facility of ICU in Nairobi was owned by Kenyatta National Hospital, which is a referral. That is the only public ICU that was in Nairobi County. Chair, in the last 3 years, we have developed, if I count the number of ICU beds that we have, Mamadusi Kibaki Hospital are 18 beds. Yeah. From there being no ICU, 4 of the main ICU, PICU, which is pediatric, 6, neonatal, 8, from 0. Mama Margaret Uhuru Hospital now has 10 ICU beds. So that is 28. Mbagathi now has 8. That is 8 plus 28. NICU, that are 4 neonatal. And by that NICU has really saved lives because it's where preterm babies born before, the babies that are born before their time. Yeah? And it's the best place I go to because I was also severely preterm. So I go there and I encourage the mothers and I do the kangaroo, which now fathers are doing kangaroo, sitting with the children, and that's from Kibra. Neonatal HDU is 4. Ongoing, right now, we're at 90% to increase another 10 ICU in Mutwini. It's 90% complete. Actually, interestingly, I posted that today. 90% complete. And we are now moved to operationalizing. Now, the ones which we've completed but are not operational. So those are the numbers that we have. It's an improvement. In 60 years of Nairobi, there's 0. In 3 years, we are at more than 30 ICU beds. But how many are enough for 7 million people? We definitely need, there's a gap. There's a definite infrastructure gap when it comes to healthcare in the city that talks about resourcing. We have 7 million Nairobians during the day and 5.5 at night. So even as we do these incremental increases, there is still a huge gap that we need to look at. And that is why, even if you look at the national government stance, while supporting public facilities, also private facilities are seen as part of health infrastructure for this country. It is true that quality control is done jointly by both the national government and the county government. We have a team of quality assurance, and and that work is done between ourselves and the Kenya Medical Practitioners and Dentist Council. So we have a role. In as much as health policy in fourth schedule is set by the national government, the county also, because health is the biggest devolved function. It has our biggest staff component in Nairobi, whether it is the doctors, nurses, clinical officers, dentists, etc. And if we had time to go into the details, we'd show you the improvements there. Nairobi, we had no dentists. Now we have more than 50 that we had every sub-county. Dental services were seen as a luxury. Today, every sub-county, there are dentists and there are dental chairs, that are available. So if we had time, I don't want to go outside this statement, we'll be able to respond to that. Chair, on the other questions...
Before you leave that, Governor, so that you can finalize with a question by Senator Sifuna.
Yes.
I think I have two questions on complete... What was that?
Yes, there's a specific project that is mentioned.
Maybe you can finalize on that one because it looks like it's along what you are speaking about.
So and I'll ask the facilities to also prepare to give more details. There was one building, 120, that had stalled. It was part of what was being innovated. It took long. It is now with us. We made first payment of 50 million shillings. The contractor came back. He is waiting for a further payment to conclude it. We'll complete that building. That is, and the contractor I know is called Vivi Contractors or Vivi Limited. You remember all pending bills under NMS. The Auditor General was clear that all pending bills are to be paid for by the national government. But this is one case where we sought exemption because we could not wait for that delay from national government. So we went ahead and paid the initial 50 million shillings. Finally, they've novated the contract back to us for us to be able to complete it. And so we'll conclude that structure. It will help ease. The biggest, because there's another question here on congestion. The biggest relief to Mama Lucy Kibaki Hospital is actually Mama Margaret Uhuru Hospital that we're operationalizing. We have completed now all infrastructure, and it started at a small level. We need to hire 1,500 staff, to get there. And so what we're doing, because I will again come back here and be told about wage bill, is we're moving a lot of these level 5s into corporations, so that they can have. Mama Lucy alone has 1,200 staff. Mama Lucy Hospital, that is the staff of some counties, the full staff. Mama Margaret will have another 1,500. Mutuini, if you see the building we're completing now, the number of staff also will be big. So we want to move, and that's why we have the CEOs and the boards at this high level. So then they can take off the payroll because of the 30% development and recurrent and the wage bill, ratios. They can then be off the payroll. Now that we have FIF and we've done the infrastructural work, and the hospitals then can run themselves. So